All right, Tammy, you can see the ball distracted from the cup. You see here's your labrum down the back. See it's yellow and degenerative and beat up all the way down to the bottom. And so not a healthy piece of tissue and a lot of bruising around it. And so the cartilage on the cup and on the ball look good, just the labrum does not. So we'll get that out and make a new one for you. I'm going to open up the hip capsule or the surrounding soft tissue envelope, and then I'll show you the front of the joint. Again, this is the back of the joint here. So now we're looking to the front of the joint. This is the labrum that's bothering you the most. You can see this is extensively torn through the front. And when you push on it, you see how it buckles the cartilage up through there. So not a healthy piece of tissue up through here. The other thing that I'm seeing here too is the bottom front of the cup here is just underdeveloped. It should form a triangle, and you can see it's almost like the cup just stops down here. Does not form that normal triangle like it should. And so if I had my way, I would like for that cup to be deeper than it is. I don't have any way to grow cup down there. But it shows the importance of the labrum. The ligamentum teres, or connection between the ball and the cup, has some partial tearing in it, but there's still a lot of it still intact. So I wouldn't do anything with that. Cartilage on the ball looks good. Otherwise, good-looking joint, just bad-looking labrum coming through the top there and getting kind of small near the top. So just kind of thready, degenerative, not very healthy. And this is the zone, I think, that every time that ball hits against, that's the thing that bothers you the most. So let's get rid of that, make a new one for you, and I think we should have you in a much better place. So you can see just the labrum coming through the top here. Each tick is a millimeter. It actually gets quite small. So it's about 1 to 2 millimeters. And as you're pushing here, you can see how you've got this abnormal motion in the cartilage. That should be rock stable. That shouldn't be moving like that. And as a byproduct of that, you can see those micro fissurings occurring through there. So this just needs to be stabilized. A new labrum will do that, and I'll stabilize that cartilage on the edge. We should have you in a much better place. Good-looking joint, just bad-looking labrum, and the cartilage again on the edge of the cup is becoming destabilized because you just don't have that protection. So we just need to get that out. That's that real bad zone. Just looking at it from a different angle, that's the part that's really creating a lot of pain for you. So we'll get this out. We'll have you set. Okay, you can see how bruised that labral tissue is in the front. This is the femoral neck. You can see it's just all beat up through here. That's what's been hitting against the edge of the cup. That's what's beat up the labrum. Okay, so what we're going to do is come across here and reshape you this way. And then I'll make you nice and spherical so when the ball rotates in, it'll fit. And you can see how beat up all this tissue is through here from where it's been hitting, especially up through there. So bad shape. Let's make it round, and we should have you set. Okay, that's your x-ray before, Tammy, and you can see there's just not that much room between the head and the neck, and you've got that big ledge out there. That's what's been hitting against the edge of the cup. That's the cam. So when you flex up, that hits the edge of the cup, and that's what beats up the labrum. So that was before surgery. This is after. So you can see now I have you nice and smooth and round, and so now that ball's going to fit into the joint without hitting. And when you look on the inside, you can see got a nice smooth shape, nice and round through here. Bone is a little bit soft, okay, a little spongy, but I've got the shape I want. So this shape will help. The shape will work a lot better, okay, but what I want you to do is I want you to make sure that your calcium and vitamin D intake are good. I also want you to maybe talk to your primary care physician about, your bone, make sure it's in a good spot, maybe get a DEXA scan. But I like this shape. This is going to work a lot better. That's going to rotate into the joint. You're a little bit unstable when I'm up here, so I think you definitely need a labrum, but I think part of that is that lower volume cup. So we're just going to, nothing I can really do about that to offset that. The only thing is that I just want you to kind of get your glutes nice and strong and keep them nice and strong, and I think that'll help you quite a bit. So let me go up in traction. I'll show you the inside of the joint. Again, we're going to lay down the labrum right here on the edge of the cup to protect that cartilage and give you more volume and more stability. Okay, so you can see we've got your cartilage nicely stabilized on the top of the cup and all the way around down the back of the cup. I haven't taken any of your cup volume. We've left it the same, but I've excoriated the edge of it. You can see you had this little indentation up through there where we had that labrum that was really extensively torn. I've left the cup the same behind it. This is where that cup should not be that small little triangle. It should be a more extensive triangle heading around. So let me just get an instrument here and I'll show you. So you can see when you look at it, see it just kind of comes down as that soft triangle. It should, you should have cup all the way out to here, coming around the front through here. That would give you more stability, and that would just give you more containment. I can't add cup, I can't make it grow, but I can make a labrum. So we'll make a labrum that comes through here, maybe a little bit more sizable, and then it'll come all the way around, and that'll give you more volume than what you have. Central ball looks good. That ligament teres is partially torn, but there's still enough of it there that I think that confers enough stability for you. But I think that the biggest thing is just getting in a new graft, trying to give this hip some more time and get stronger around it. It's just that borderline shallow. That I think caused this to wear down, but especially the shape of the ball. That ball shape was terrible. We now have a much better shape for you. So let me get a proper graft in here, and I think this should get you feeling a lot better, Tammy. All right, Tammy, so we have your graft all the way down to the bottom of the joint, coming up nicely through the top and over the top. So this gives you more size, gives you more volume, gives you a lot more stability. When we didn't have your labrum, your ball had a little bit of looseness to it, and so it was sliding in and out a little bit. But now that we've got the graft in, it's very solid, and so I think this is going to feel a lot better. Got a lot of fixation through there. It's about a 12 centimeter graft that we've got fixed with 13 anchors, and so I think that's going to heal in very nicely for you. You can see your cartilage looks great on the edge there. So I think we're set. And if I switch portals now and I look from the front portal down the back, you can see all the way down the back bottom of the joint. That looks great. Looks nice coming up that back wall. And so I think this should be a lot more comfortable for you. That labrum that you had was really quite beat up. This is going to be a lot more functional labrum than what you had before, and a lot more rigid on the edge, which is what we need for volume and stability. So let me put the ball back in the cup, and I'll show you what it looks like forming a nice seal with a femoral head. Okay, now we've got the joint reduced, and you can see we've got a perfect seal between every element of the labral reconstruction and the femoral head, going all the way around the back of the joint beyond where I can show you, and then a nice shape to the femur. So that should protect our graft moving forward, and it looks great going down to the bottom. And then in this position before, when we push against your knee against the post, the ball would slide out. Now it's staying nice and solid, so I think we've got you in a good position. Just get nice and strong with your glutes. Keep them nice and strong for the long term, and I think this should be a much better joint for you. I wish you all the best, Tammy. I hope this gets you out of pain and back to all the things you enjoy doing. All the best to you.